ahead. Hi, how are you doing today? Good. My name is Kaylee. I'm a nursing student at Newman. We're going to be doing a dressing change, a sterile dressing change for you. Is that okay? Okay. Are you in any pain today? No, no pain? Okay, good. Can you tell me your first and last name? All right, and your date of birth? All right, and what are your allergies? All right. My patient stated that they're in no pain. If they were in any pain, we would administer medications. And we have oral medication, which would be about 30 minutes before we change, or IV medication, that's pretty instant. And then we have intramuscular, which would be about 5 to 10 minutes. But they said they're in no pain, so we'll go ahead and get started. Is it okay if I place this bag over here for you? The dressing change? Yeah? Okay. Tuck this under just in case there's any drainage. So we're gonna slowly take off this bandage, one layer at a time. Gonna assess for any blood or drainage, and then about how much is on there. Same thing, we'll do one layer at a time. At the same time, we're gonna note if there's any odors going on with this. Are you still doing okay? Okay, good. Go ahead and pull this out. All right, same thing, we're gonna assess for the amount of blood that's on here, the color of drainage, and then if there's any odor that came along with it. At the same time, we'll be assessing for RETA, so the redness, the ecchymosis, the edema, the amount of drainage, and then if it is approximated, which it is not approximated, it is an open hole. I'm gonna make sure the patient doesn't need to use the restroom, or make sure that they're positioned okay as well before we get started, which they are. So we'll go ahead and get started. And these gloves don't fit me very well, so I'm going to use a different pair of sterile gloves. But before I do that, we're going to make sure everything is ready. I'm going to pour just a little bit out. I'm going to go ahead and pour this. And then same thing, I'm gonna get this ready. All right, now I'm gonna put on my sterile gloves. Making sure not to break sterile field. Gonna set everything up so it's ready to go for us. Don't need these two, so just gonna drop them over there. I'm gonna put that in there. Then get a couple pieces of gauze ready to clean the wound. Gonna start with the inside first and go in a circular motion. All right, and the last thing we're gonna do is put in the rest of the wound packing. All right, you might feel a little pressure. Let me know if you're in any kind of pain. Alright, since the previous packing had 3 pieces, we're going to do the same thing, making sure we're only touching the outside edges. Gonna cover that up, and then gonna put an ABD pad on. And we're gonna tape it. At this point, once I tape it down, we're no longer in a sterile field. And on the last one, we're gonna go ahead and label it, my initials, the date, which is 10/16/19, and the time. All right, so at this point, now that the dressing is on, we're gonna throw everything away. These will go in the sharps. We'll close all of this up. If there's anything bloody, so like this will go in the biohazard. That in there. My gloves will go in the biohazard. Start this in the biohazard. Ideally, it wouldn't fall out. But we're gonna pick it up like it didn't fall out. I'm gonna do hand hygiene. Cover the patient back up. Make sure that they are comfortable. Document appropriately, and make sure the area gets all cleaned up. Like I said, these will go in the sharps. And are you doing okay? All right, that's it.